Peripheral artery disease affects 18 million Americans and, if left untreated, can lead to amputation. Listen to these numbers. In the U.S. alone, 180,000 amputations occur annually. And here's the bigger tragedy. Half of those could have potentially been avoided. Baptist Health is working to improve those outcomes. Vascular surgeon Dr. Landon Humphrey and wound specialist Kim Young, who is also the director of Baptist Health Wound Clinic, are here to educate us a little more. Welcome, both of you.
Thanks for having us.
Those numbers are crazy.
They are.
I had no idea, and you see it all the time in your office. Let's talk a little bit about peripheral artery disease and what that is, and then who might be a candidate for this kind of treatment.
Yeah, so peripheral artery disease is basically when you get blockages in the artery. So you can think of it as people have blockages in their coronary arteries in the heart. That causes a heart attack or an MI. You can have them in the legs, you can have them in your neck, that can cause a stroke, but the ones we're interested in this particular instance is the blockages in your legs, and there's a lot of arteries in your legs that are important, and when you start getting the disease there, you limit blood flow and can ultimately develop wounds on your foot that won't heal and get an infection, and ultimately kind of the way we have to control that is we have to take the limb.
Yeah, so what are those the symptoms that we need to be paying attention to? The earlier you take this on,
Sure.
the better the outcome?
Sure. So symptoms are kind of insidious and slow to develop, so people a lot of times don't recognize that that's what it is. But the first symptom that usually shows up is people will get kind of a cramping pain in their calf when they're walking, especially if they're walking upstairs or going uphill. And when they stop to rest for a little while, 5 minutes or so, that goes away and they can kind of continue going. We call that claudication. And then that can develop into pain at night where their legs hurt all the time. That's in more severe kind of advanced cases when we start getting into tissue loss. We start forming wounds just from not enough oxygen getting to the tissue. Quite literally, that's what causes it. The tissue just starts to wither away and die.
Yeah, and it's an insidious problem to have happen to you, and you do need to take action. But this, Kim, this is wonderful.
Yes.
What Baptist Health is doing. This wound clinic is fairly new, right? Since April, right?
Yes, sir. We started the limb preservation program early April 1st. We started enrolling patients. Our goal is exactly what Dr. Humphrey is talking about. We want to not just treat the wound, but treat that cause of the wound. So some of the things that we do, and we want to do it early on to really figure out what's causing the patient issues in their legs and their feet. We do tests to look at blood flow, like Dr. Humphrey was mentioning, to see if they do have that peripheral artery disease. And then we streamline that process to get them to a physician that can help put stents in and open up the blood flow there. Some of the other things that we're doing with the program is treating the whole patient. Smoking causes a lot of vascular issues, and so getting them with smoking cessation. Dietitians, so diabetes is another big risk factor, and so we make sure their diabetes is well controlled, put them with a dietitian. But not only if you have diabetes, but wound care in general causes an increased need for protein that a lot of people don't realize. So having that dietitian there to help them make sure that they're eating enough to help with that wound care. So we're trying to do everything early on instead of expanding it.
Doctor, so it sounds like lifestyle obviously plays a big factor in this. What about genetically? Are we also predisposed to get
There is
something?
a predisposition genetically, for sure. Some people are going to be more prone to that just based on their family history. But you can't change your genes.
Right.
So we really focus on the modifiable risk factors, so things like diet, exercise, like Kim said, smoking cessation, and doing things to decrease that risk. Smoking being the largest risk factor. Smokers are probably about 20 times as likely to develop peripheral artery disease as non-smokers.
So when somebody gets diagnosed with this, and I suspect there are different stages of it, when you're diagnosed, what do you, on your end, what are you doing to prevent to the point where we have to have an amputation?
The first thing we do is, again, start with lifestyle modification. So one of the first things you need to do is increase your activity and regimented walking programs. So starting to walk until you get pain, have to stop and rest, and then you go again, and you try to get like a set distance, like a half mile, and build that up. there's pretty strong data to show that that will reduce symptoms. It actually kind of tricks the body into building new blood vessels in a way.
Yeah.
And then we can move on to interventions where we have both endovascular interventions, which is kind of like a heart cath, but in the legs, where we can put stents in, we can remove the plaque. There are a couple different ways we can do that. We can use balloons to kind of pop the vessel open. So there's a lot of things we can do with that. And then from there, you move more to like your open surgical things where we actually bypass around the artery with vein or whatever we need for a conduit for that.
For the both of you, it's got to be incredibly gratifying to know that you're preventing somebody from having to, maybe just a few years ago, would have had to have an amputation.
Sure, yeah. So it's a big deal. I like getting up and going to work in the morning. I have a really great job. But it's because I get to go to work. I get to work with fantastic people, with all the people that are involved in this, with our, our nutritionists, our physical therapists, our, Kim, my nurses at the clinic that I work with every day. And then at the end of the day, I get to go home and say, well, we did some good.
Yeah.
And so that kind of keeps you energized and keeps you coming back for more.
What more can you ask
right,
out
exactly.
of life? Exactly.
Yeah.
Kim, what you're doing here is not found everywhere. What you're doing is pretty novel and pretty unique to Arkansas, for sure.
Yes, sir. From what we understand, we're the first program, limb preservation program in the state. It's definitely something needed. Our patients, they're very appreciative, kind of your previous question of we're doing good. It's great to hear their stories and them learning the lifestyle modifications that they didn't know that they maybe even were doing something incorrect. So it's, and we try to get that back to the group as a whole, the dietitian, the physical therapist, and all of us working together. It's great.
Kim, we've got a telephone number
Yes.
up on the screen, but if you're experiencing some of those symptoms that the both of you detailed there, better not to wait. Get on top of this problem so we can have the best possible outcomes. What do you recommend they do? Call the number and set an appointment? Or?
Yes, sir. If you have any issues, wound issues, not just on your legs or your feet, but just anywhere, give us a call, 501-202-3638. Our clinic is located in the second floor of the Baptist Health Medical Center, North Little Rock, and we're here to help.
Congratulations to the work that both of you are doing and what Baptist Health is doing, something very, very well needed in the state of Arkansas.
Yeah,
It's great,
thank you.
Great hanging out with you.
Thank you, Steve.
Thanks for having us.
Yes.
Appreciate it. My pleasure. Absolutely.